Fibromyalgia can be hard to live with, it's difficult to diagnose, and it's often misunderstood by both people who live with it and even their doctors. Well, this new book from Mayo Clinic Press aims to change that, and here with the details is Dr. Barbara Bruce. Doctor, thanks so much for joining me.
Thank you for inviting me.
So why is it that this disorder is so fundamentally misunderstood?
Fibromyalgia has been around for decades under different names, the same constellation of symptoms. And there is not a blood test, and there's not an x-ray, and it has been very difficult to diagnose. And there's been a lot of misconception about what fibromyalgia is, with patients being told that perhaps their symptoms were just in their head, or that they were making the symptoms up. And we're finding out from a science standpoint that that information is completely inaccurate.
So what actually is it?
It's a chronic illness. It's a chronic disorder. Patients have pain, they have fatigue, they have trouble sleeping, they have trouble feeling as if they slept. Sometimes thinking is difficult. To give you an example, my patients tell me, imagine if you woke up every morning and felt like you had the flu. My patients are achy, they're sore, they're exhausted, and they feel like they're having trouble navigating through their day.
And the reality is that there are ways to manage this, right? So let's talk about treatment options for those who live with it.
There's some drugs out there that can be helpful, but there are also other lifestyle strategies that can make a big difference. We try to outline those in the book and give people a game plan, a strategy for going forward to be able to sleep better, to be able to feel better, and to have less pain so that they can get their lives back.
Excellent. And so, of course, there's easy to follow steps too on a daily basis that they can use to manage that pain, right, and discomfort?
There are, and thank you for asking about that. There are things that help, things like the way my patients think, the things that they're focused upon, the way they ask for support from their families, the way they start to move again. Exercise is probably the dirtiest word in fibromyalgia because my patients are exhausted and they hurt. It's the last thing they want to do. But research tells us that if we can get patients moving slowly and in a stepwise fashion, that moving can be an effective strategy in feeling better and sleeping better.
Right. And so if people want to learn more, obviously the book's a great place to sort of start learning about it. It's full of great strategies, etc. What else should they know, and where should they go? I'm sure talking to their doctor is probably the place they should start.
When you look at the beginning of the book, we actually lay that out for patients. If they're worried they have fibromyalgia or they've been diagnosed with fibromyalgia, to take that information to their primary care physicians and begin to sort out what is wrong. Certainly the symptoms of pain and fatigue can be from other illnesses too, so you want to make sure that the diagnosis is accurate, but partnering with that primary care physician is a great first step in beginning to feel better.
It's all about getting educated. Dr. Barbara Bruce, thanks so much. You're watching The Morning Blend.